3.
Hello everyone and welcome to Health Talk. I'm your host Kim Beckett. Well, cutting edge, minimally invasive, and early detection. These are all medical buzzwords that we hear often these days. We have some exciting early detection information that's going to be shared with us today by Dr. James Presley. How are you?
Very good, ma'am. Thank you very much for inviting me.
Nice to see you again, and thank you so much for joining me.
Thank you.
Let me just quickly tell our viewers, first of all, Dr. Presley will be giving us some information regarding ovarian cancer, and Dr. Presley is a board-certified obstetrics and gynecology. He is in private practice here in Vero Beach and on staff at Indian River Medical Center. Thanks for coming.
Well, thank you, ma'am.
Okay, let me just start off by asking you, what exactly is ovarian cancer, and why is it so difficult to detect early?
Good question. Ovarian cancer, of course, is cancer of the ovaries. It's hard to detect early because it really doesn't cause a lot of symptoms that the patient can perceive as being very abnormal. A lot of the symptoms it causes are very vague, including some vague abdominal pain, some back pain, maybe a little bit of urinary incontinence, things that you just would not attribute to anything major going on in your abdomen. It's just very nonspecific, a little bit of bloating, maybe some problems with your bowel movements. So the symptoms of ovarian cancer can be there are symptoms, but they're very vague and not really pointing to the ovaries, actually.
And so what are some risk factors that would possibly set you up?
Risk factors for ovarian cancer, one is family history.
Okay.
So that if you have a close relative, a mother or a sister with ovarian cancer, that definitely increases your risk for ovarian cancer. Other risk factors would include endometriosis, believe it or not.
Wow.
Early menarche, which means the earlier you start having your periods, that is a risk factor. Late onset of menopause, the longer you have your periods. So those are kind of risk factors. And on the other hand, then, things that will help decrease your risk factors are having children, going on birth control pills, and like I said, pregnancy.
Going on birth control pills?
Mm-hmm. Birth control will actually decrease your risk of ovarian cancer.
Very interesting. Now, let me ask you this, Dr. Presley. Okay, I come every year and I have my pap smear and I get my medical exam. Aren't I covered? Aren't I making sure that I...
You are, and that's actually the recommendation right now, is come in for your annual examination and get your pap smear. Pap smear, though, is a screening test for cervical cancer, not ovarian cancer. The pelvic exam, actually what we call the bimanual examination part of the exam, where we actually will go in and actually try to feel your ovaries, is probably the more sensitive part of your annual, and that's still important to do that. But unfortunately, that's all we have right now to detect ovarian cancer. The best weapons we have right now are increased awareness of the patient and the physician that it can happen.
Right, and like you say, family history.
Family history, right.
I would say so in this case, that's probably the best piece of information when you're talking about
family history. About 10% of all ovarian cancers actually occur in patients with family histories.
Wow. And so what about the other 90%?
90% there's no family history.
Wow, that's amazing.
Yeah, so the good news is that ovarian cancer is not that common. It's the second most common gynecologic cancer behind uterine cancer, but to put it in perspective, a woman's chance for breast cancer is 1 in 8. A woman's chance for ovarian cancer is 1 in 70.
Wow.
So it's not real common.
That does help put things into perspective.
Right. The problem is that ovarian cancer actually causes more deaths than breast cancer, cervical cancer, uterine cancer all combined. Ovarian cancer does cause more deaths than all of them.
And that's because we really don't have good early detection, is that correct?
70% of all women actually will present when the cancer is already in advanced stages, stages 3 and 4.
Right. So tell us your exciting news. We have got some new testing that is
There is a new test that came out. It's not really for screening, so I want to preface this, that there's still no good screening test for ovarian cancer. But there is a new test that just came out on the market within the last year or so. It's called the OVA1, OVA1, and it's another tool we have in the woodshed, as we say, to help us try to determine how to treat our patients. And it's a test of 5 different immunoassays that if a patient does have a cyst or a mass in her pelvis, we can get this test and it'll help alert us to the fact that there might be an ovarian cancer going on, and then we can get that patient in to see the proper specialist for her surgery to have the best care for that woman.
Right. And so, who are you going to recommend that have this test?
Right now, again, it's not for screening. So any woman that comes in with a pelvic mass or a cyst, we're unsure as what's causing it, we're concerned about the possibility for ovarian cancer, this would be the candidate for a woman with this test. Usually surgery is already going to be planned, so we're trying to decide whether to do it here locally in the community or whether she would best be served by going to a GYN cancer specialist. We call that a gynecologic oncologist. Those are the patients where this test is actually aimed at. So it helps give us alert as far as the fact that there might be ovarian cancer here. So it's just another tool.
That's wonderful. But it's a big deal.
It's a step forward, yeah. We're hoping there's more tests coming down the road, but at least this is the first change that I know of that's been in the last 10 years as far as changing.
Right. But otherwise, making sure that you do have your annual exam
yes,
is
ma'am.
really, really important.
That's still the most important thing,
okay.
yes.
Okay. And then tell us a little bit about treatment.
There are really exciting things going on as far as treatment, and I've seen some big advances since I've been a physician and gynecologist in the last 20 years. And we're seeing much better responses to the chemotherapy and to the treatment for ovarian cancer. Now ovarian cancer is a very chemo-sensitive cancer, believe it or not. So it does respond to
that's wonderful.
It does respond to chemotherapy. They've got a lot of nice new regimens out there now for our patients with ovarian cancer. We also are doing intraperitoneal chemotherapy, where they actually instill the chemotherapy right in the abdominal cavity. And there's a lot of new protocols out there.
Let me ask you, so if you do that, if you put it right into the abdominal cavity, do they not get as sick when they have their chemotherapy administered that way?
There are some symptoms, but yeah, they don't seem to be getting as sick. But usually the first line is still going to be your intravenous chemotherapy. And sometimes we're doing second look operations, see if there's any residual, or watching a test called the CA-125 count. And then you can follow that up with intraperitoneal chemotherapy if we need to. And there's a whole lot of other regimens coming down the pike too.
That's great.
So it's going to be a very treatable disease.
That's wonderful to hear, because I know anytime we talk about cancer and treatment options, the first thing that's always brought up is let's detect it early.
Amen. Yeah, that's the most important thing, is we really try to find ovarian cancer as early as we can, and we're still not doing a real good job, but the new OVA1 test at least is another step forward.
Right, right.
So we're excited about it.
And when is that going to be available?
It's available right now.
Oh, it is?
It's available right now.
Oh, that's
It's out on the market. So we can order that at any point we need to if we have a patient that we're trying to work up for a pelvic mass.
And do you have any other advice that you would like to give women out there regarding this subject?
Just be aware of the early symptoms, that ovarian cancer can cause symptoms, and these symptoms are very vague, and bring it up to your physician if you have a concern, and ask to see a gynecologist if you want to, if you're seeing a family physician about these concerns. But again, the early satiety, where you get full changes in your bowel habits, your bladder habits, abdominal pain that's new, anything like that that's new over the last several months that seem to be persisting, let's go ahead and check that out and ask your doctor about that. Just increased awareness, really.
Okay. That's wonderful. Well, Dr. Presley, thank you so much for
thank
this
you, ma'am,
great
for inviting me.
information, and I hope that you have enjoyed today's segments of Health Talk.